Thank you for tuning in to this session of the Health for Climate Learning series. As the recent COP28 climate conference comes to a close, our focus now turns to reflection, analysis, and the implications of the outcomes of COP28 for Southeast Asia and the health community in the region. In this COP28 debrief, join us as we speak with delegates from Healthcare Without Harm Southeast Asia and Parabukas to dissect key developments, draw connections to health outcomes in Southeast Asia, and collectively reflect on what next.
Very, very busy, but that's 3 words, so just busy.
My word is adrenaline or coffee, which is almost the same thing.
My one word for COP is inspiring. I met so many people, from fisher folks and farmers, youth from different countries, policymakers, specialists, and scientists who I've learned so much from during the 2 weeks in COP. It was a great opportunity to meet these people, interact with them every day or during side events or during negotiations, and hopefully forge collaboration for future partnerships.
In one word, I would describe my COP28 experience as emotional. It was a roller coaster to be in a space with so much progress yet pitfalls, so much contradiction and action, and so much collective hope building and coalition building, but also grief. So if I could sum up my experience in one word, it would be that it was a really emotional experience for me.
I describe my COP28 experience using the word big. Big because the venue is very big, the prizes are very big. On a more serious note, the expectations for COP28 is very big. A lot of key decision items should have been adopted in this COP. COP28 also left a very huge or a very big gap that I'm going to further explain later on. And finally, it's big because this is my first ever COP28. And being in the process, following the negotiations, joining side events, interacting with people, left a big impact on me that will help shape what I will be doing in the next couple of years.
For Parabukas, COP28 was the first time that we were able to bring all our younger colleagues with us for the first time. We had 6 projects running that had deliverables relevant to COP28, so it was very important for us to have a big team there. And for us personally, I think, for me and Niner, we also felt that it was important to introduce younger people to the process and to support them throughout that, because you can study, you can prepare all you want before COP, but the only way to really learn about the convention and how the negotiations work and how all the dynamics of the negotiations work are by going to COP yourself and experiencing things there for yourself. So, projects aside, the deliverables of our projects aside, I really hope that the team gained a better understanding of the process, as well as to see where they fit in, given their own interests and given their own expertise. And I really hope they'll want to come back again next year, because there's still so much to do, especially with the UAE consensus. We know that there's still so much work that needs to be done.
As an organization and as delegates of Healthcare Without Harm Southeast Asia, we were both excited but also quite terrified coming into COP28, as we know that it will be hosting the first ever Health Day in the history of COPs. So it was a big mandate for us to make sure that we are putting health at the center of the climate negotiations, to bring in health voices and amplify messaging from the Southeast Asian health community, making sure that we are taking up space at COP, and also to ensure that Health Day is not used as a health washing method at COP. We don't want health to become a distraction from the key things that we know needs to be achieved at COP. For example, the phase out of fossil fuels. But in terms of achievements, it was definitely a breakthrough for us to see the presence of ministries of health from all around the world come together at a space like COP. I believe we saw over 60 ministers of health and over 100 representatives of ministries of health during Health Day and throughout the duration of COP. Which is traditionally a place that does not necessarily include the health community. And we were also really proud to see that our site events became a way to break some of these silos between climate, health, and also other sectors. So, for example, we had an event where in the Green Zone where we talked about the importance of integrating health into climate education. And so naturally, people from the climate sector, from the health sector, but also from the education sector came together to be a part of that conversation. In another event, we talked about just transition when it was also Indigenous Peoples Day at COP28. So we also invited a representative of an Indigenous community who was able to speak about the role of community-based practices in the just transition. And I think as delegates from a health-based organization, it's really empowering to see the health community lend solidarity to the climate movement and to see the climate sector open up that doors for our voices and our presence to be a part of this process.
The UAE Consensus is the package that contains the key decision items negotiated and adopted during COP28. Our reaction, first, of course, we welcome these decisions. Given the circumstances that we had at COP28, with an oil magnate at the helm of COP28, and with the sheer number of fossil fuel lobbyists in COP28, we're still able to achieve that kind of outcome where fossil fuel was included in the text. Of course, we also welcome the Youth Climate Champion Declaration, which emphasized the involvement and participation of young people in UNFCCC processes. And not just that, even downstream that on national and local climate policy making processes. We also welcome the adoption of the operationalization of the loss and damage funding arrangement, including a fund, and the pledges that were already made for that fund. Also, another noteworthy achievement, if I may call it that, is the operationalization of the Santiago Network for Loss and Damage, which would hopefully help developing countries avert, minimize, and address loss and damage that they experience because of climate change. Then we also have the adoption of the outcome text for the global stocktake, the first ever global stocktake since the adoption of the Paris Agreement. We now have a just transition work program. The Glasgow Sharm El Sheikh work program on mitigation implementation have been finalized in this COP. So these are positive things that we recognize. However, it's also important to mention that there are huge gaps that the UAE consensus left. For example, in the global stocktake, this is the first ever global stocktake that aimed to take an inventory of the climate action done by countries with respect to the Paris Agreement rules. This is supposed to provide guidance as countries update their nationally determined contributions. While it is good that there is a mention of transitioning away from fossil fuel, the timeline is not enough. It's unclear. The whole text is filled with ambiguous terms. The principles of CBDRRC are the common but differentiated responsibilities and respective capacities. And the principle of equity was not highlighted that much. Why is it important to highlight these principles? Because this reiterate the responsibility of developed countries, the Annex 1 parties, to lead climate action, both in transitioning away from fossil fuels and providing the means of implementation based on the needs and priorities of developing countries. However, based on the texts that were adopted, it fell short on those principles. It did not stress how important it is for developed countries to really provide the means of implementation based on the needs and priorities of developing countries, because the implementation gap is very huge and there is a need to close that implementation gap. Because without the proper means of implementation, developing countries would not be able to transition away in a just manner from fossil fuels. Developing countries would have a hard time adapting to the changing climate. And note that with an additional increase in temperature, the climate impacts will be worse. Thus, the adaptation needs of developing countries would be more. Before I end, I just want to share what happened during the closing plenary. So when Sultan Al-Jaber recalled the agenda item on the Global Stock Day and said that hearing no objections, it is adopted. The room was silent. Al-Ghafat was silent, which is a stark contrast to the cheers and applause from the Al-Hayrat plenary hall, where parties were present. Because us in the Al-Ghafat plenary hall observers were shocked. The draft decision text that was adopted was released around 3 or 4 hours before the closing plenary. So there's not enough time for parties to actually deliberate on this outcome text or on this decision text. It's very saddening that as Samoa, in behalf of small island developing states, mentioned that they were not in the plenary when the motion or when the decision was adopted. Yes, it might be called a UAE consensus, but it's a question whether or not every stakeholder, not just the parties, but even non-party stakeholders, agree on what was adopted. However, since all these decisions were already gaveled down, we can just work on these decisions and put pressure on decision makers, especially those responsible to climate change, to exert more effort and go above and beyond the texts. At Parabukas, we'll continue monitoring these work streams. If needed, we'll still provide technical support during the SBs or COP29 in Azerbaijan.
So a groundbreaking development at COP28 was the adoption of the COP28 UAE Declaration on Climate and Health. And during a historic ministerial meeting on Health Day, health ministries worldwide came together to endorse this declaration, making a global commitment to actively address the climate-related health impacts. And as of today, I believe more than 140 countries have already endorsed the declaration, including 8 Southeast Asian countries. So what they committed to is to improve the ability of their health systems to anticipate and implement adaptation interventions against climate-sensitive diseases and health risks, promote steps that will actually lower their carbon emissions as a sector and also reduce their waste, and also facilitate collaboration on human, animal, environment, and climate-related health challenges. So these actions are absolutely critical for this region because of the immense and increasing impacts of climate change that we are witnessing at the population and community level, but also with our health systems, with how our health systems are being pushed to the limits because of the crisis and other compounding crises that many of the countries in this region face. So while the COP28 declaration marks a significant milestone, it represents just one of the many initial steps that we need to take to actually have healthy people on a thriving planet. And I would say a major hurdle for climate and health initiatives in the region lies not in the lack of intent. Many of the governments here in this region actually are already prioritizing this work. They've conducted their vulnerability assessments, they've developed their own health national adaptation plans, they've started baselining their greenhouse gas emissions, and so many more. The primary challenge is securing the financing required for the implementation of these plans and policies. And at COP28, several financial commitments were also made for climate and health, including an announcement of $1 billion. This is absolutely tremendous and very much welcome. Now, the challenge is, how do we make sure our Southeast Asian countries actually have access to these funds, that they actually get these funds to implement those policies and plans that they've set out?
So the COP28 outcomes have a lot of implications for the Southeast Asian community, both for the countries and the various other stakeholders. The global stocktake, for example, will form the basis of plans, strategies, policies, and actions for the coming years, especially as countries move towards developing their next set of nationally determined contributions. So the NDCs, if you recall, have to be progressively ambitious. Countries cannot backslide. So the targets have to be higher, more progressive than they were before. And right now, it's clear that the world is not doing enough to address climate change. So this is a chance for Southeast Asian countries and stakeholders to develop and/or fine-tune plans and strategies in order to address the needs of the people in the region, to show people how climate change truly affects communities on the ground, and to show how they intend to be effective partners and actors in all of this. The Just Transition Work Program is actually also another interesting outcome. It would be good to see what Just Transition truly means for Southeast Asia. I think it's a necessary part of working to address climate change in the region and globally as a whole.
The greatest impact COP had for me is being there alone. Like, it was already the highlight of my year, or like a highlight of my COP, of being there alone. And finishing those 2 weeks strong for me is an achievement. I also learned a lot from Parabukas fellows and Healthcare Without Harm partners and other stakeholders. One of the highlights is also attending side events, and one of my favorite is the side event on mental health and climate change. I saw spaces where I can contribute more as someone, not just a policy specialist of Parabukas, but also a graduate student of psychology, where I can use my personal interest or my graduate studies interest in enriching global action. And it was also a great opportunity to meet other psych researchers who wants to strengthen the nexus between climate change and psychology and mental health. Another highlight of mine, aside from attending that side event and learning from COP negotiations in general, is organizing a side event in COP. Parabukas, together with Manila Observatory and GIZ, we organized a side event on experiences of and responses to loss and damage. And it was like the discussion during the panel was very personal to me as someone from a very vulnerable country to climate change, such as the Philippines. We were also able to support other side events on strengthening ASEAN voices during COP. And I've learned so much. Again, I've learned so much from these people who were speakers and panelists in these side events. And lastly, the highlight, of course, is joining negotiations. Just like what I've said earlier, is that the biggest impact and highlight of it is just being there alone. So experiencing all of these as a first-time COP goer will forever leave a mark in me and will forever be a great memory. And I hope I would have more opportunities in the future to join COP, join these side events and negotiations, and create bigger impact, not just in COP, but outside of COP in the general global climate action.
So this is my second COP. And when I went to Sharm el Sheikh last year, I felt extremely overwhelmed. That was my first time, and I think everyone who goes to COP for the first time feels a little overwhelmed because this process is a lot and you can easily get lost in the space. And I think a personal achievement for me this year would be not getting overwhelmed as I was last year. And I think it was because I was more intentional, more focused this year. And that helped me achieve so many of the professional and personal goals that I have for this year. We took the opportunity to meet as much health ministers, health ministry representatives as we can from Southeast Asia, to talk to them, to support them throughout the COP and beyond, to strengthen the relationship that we have with them. One particular highlight would be the Philippine Department of Health Secretary announcing that they're joining the Alliance for Transformative Action on Climate and Health during the ministerial meeting on Health Day on December 3. And that's particularly significant because we have been actively advocating for this. And on a personal note, I think connecting with both familiar faces and new friends that was also a significant highlight. Especially reconnecting with my women and Global South colleagues. It's just knowing that you have a network of warm, supportive, like-minded individuals, those who share your pain of growing up in a country, in a region that's extremely vulnerable, where you constantly face so much injustice on so many levels. I think that reinforced that sense of solidarity within the community, and just a reassurance that you are not alone in this was particularly comforting.
So we had a lot of work coming into COP28. We needed to track negotiations. We had to hold and take part in side events. We had to provide support to various delegates and organizations. So a personal achievement for me would be just hanging in there until the end. But seriously, this COP had a lot of milestones for me in many ways. We had, for example, a side event on how to make climate action more deaf inclusive. And our being able to bring to the COP the experiences and the insights of the Filipino deaf community in relation to climate change brought us a real sense of fulfillment. For me personally as well, having a team at COP and watching them work was a definite highlight. It was the first COP for all of them, and it just made me so proud to see how well they did, how they rolled with the punches. And, at COP, there are a lot of punches, and to see how quickly they learned. So proud of this amazing team.
Personally, I think one of the most difficult part was grappling with all of the contradictions and controversies of COP28, knowing that it was going to be held in a petro state, knowing the presidency that is leading this climate negotiation process. It was difficult to come into terms with that at the beginning because it's hard to hold out hope, knowing that we might not get the outcomes that we need at this COP because of how the conference is structured and the way that it is being led. Even from an organization point of view, it was also quite difficult for us in the beginning, especially to create that positioning and our stance with many of these contradictions, because we also wanted to make sure that us coming into a space like COP28, us coming into the COP with the first ever health day, our presence there and our work there is not an enabler for health washing. Another challenge faced was also how do we balance between emotionally investing but also emotionally detaching from the process and from the outcomes of COP28, reflecting on what happened in previous years and in previous COPs that I've been through. It is really hard to detach ourselves from the outcomes because we come into this space with so much preparation, so much work that's being done beforehand, and to then find out that the outcomes does not match the urgency of the realities that we are seeing on the ground is really emotionally difficult to deal with. But a quote from a friend of mine, another youth in the front line, who said that we only lose when we quit. And I think that builds hope inside me, knowing that the work does not start and finish at COP. The work happens before COP, the work happens during COP outside of the negotiation halls, and the work definitely continues to happen after COP28. Moving forward, I keep my hope in the community that we are anchored in, and I think we can continue to strengthen each other, empower each other, and hold each other tight as we move forward from COP28.
The biggest challenge for me is, I feel like, the sheer size of the venue alone and the volume of the people. As a first-time COP goer, this made it more overwhelming. You wake up in the morning and at 6 a.m. and then you try to check the venue, and then sometimes if you make a mistake in the venue, it'll take you around 10 to 30 minutes to go to the correct one, and by around after 10 to 30 minutes, so much discussions and negotiations have already happened given the big venue. It was also very tiring. Walking from the meeting room to the side event room would take 30 minutes, and sometimes you would get lost from the sheer size of the venue. It was also not very friendly for persons with disabilities, like the venue alone. So I feel like that's one of my biggest challenges. But aside from the volume of the people and the size of the blue zone and the green zone, one of the biggest challenges also is that it's me figuring out how these debates over minute details would translate on the ground as someone who've worked in Envi NGOs for the past year. And I feel like attending these negotiations and following this work stream, I believe that that's one thing that we have to ensure moving forward, that all these texts and decisions will really make an impact on fighting climate change, and they're not just mere document or paper, as well as secure the rights and welfare of communities most vulnerable to climate change. I feel like realizing that how these would translate to action, to global climate action, was one of the biggest challenges I had to figure out while joining side events and attending negotiations. And I really hope that they would make impact to the people who need these solutions the most.
The outcomes of this year's COP are not the best. Definitely not enough to keep the 1.5 degree alive. Definitely not enough to stop the devastating impacts of the climate crisis on our nations. But we definitely see positive movement towards finally addressing the root cause of the crisis, which is fossil fuels. But we need to remind ourselves the outcomes right now are not enough. There's still so much more that we need to do. And I think what this pushes us to do is to continue fighting. Fight against the fossil fuel industry. Fight for our communities. Fight for our children. Fight for our health. Fight for our future. I would say particularly for the Southeast Asia health community, we need more doctors, more nurses, more community health workers, more health professionals talking about climate change, actively engaging in conversations about climate change with their colleagues, with their patients, with the communities, with their local and national leaders. You're one of the most trusted professions in the world, and people listen to you. We need your voice, not just at the COP stage, not just at the Global Climate Conference stage, but on a daily basis. Talking to your patients and talking to your colleagues about the connections between climate change and health is important. I think it's important that we collaborate, our health community, our health professionals, our health facilities collaborate with impacted communities to understand the intensifying health impacts of climate change on them and to co-develop, co-create solutions with them. We need to also support our health ministries as they implement and realize their commitments on developing climate resilient low carbon health systems, but also holding them accountable for these commitments and ensuring that the policies we have at the national level, subnational level, align with the urgency of the climate crisis. And I think just on a last note, that we have to remember that yes, COPs serve as crucial milestones. They're an important process, but they are not the ultimate solution. The work does not end with the adoption of outcomes at COP. Instead, the work happens every day, before, during, after COP. And I think it is in these moments that we have the potential to make tangible and lasting impacts in our region.